Alrighty, so thank you everyone for joining us today on our COVID-19 update. My name is Stephanie Badillo Sanchez. I'm the Communication Specialist at the Yakima Health District. Hola a todos, gracias por acompañarnos hoy en nuestra actualización de COVID-19. Esta próxima semana, que sería el 4 de mayo, tendríamos nuestra actualización en español a las 6 p.m. aquí vivo en Facebook. So, por favor, miren esa actualización la semana que viene. So the CDC and the FDA recommended the use of the Johnson & Johnson COVID-19 vaccine to resume in the United States after a temporary pause. And additionally, there were new updated recommendations for fully vaccinated people. So today we will have Dr. Yeka, Interim Health Officer at the Yakima Health District, who will be able to give us more information on this matter. And additionally, I will be giving more information about the Community Vaccination Center. As you had heard us here previously before starting, we are wanting to encourage our community to continue getting vaccinated and address any hesitancy that there may be. And I'll also be talking about how it is free, easy, and accessible for our community to access this site at the Yakima State Fair Park. So if you have any questions about the Johnson & Johnson vaccine, the Community Vaccination Center, please make sure to put them on the comment section here at Facebook, as I will be monitoring it, and then we can address them here at this COVID-19 update. If you have other questions outside of these, please feel free to continue adding those questions on there, and we can try to answer those. And if we can't, then we will definitely answer those at a different way as well. So today we have Dr. Yeka. So Dr. Yeka, would you be able to tell us a little bit more about the Johnson & Johnson vaccine and how that pause was now lifted and we are able to use it now in the United States here? Thank you for being here today.
It's good to be here. Yes, we did have a pause in the Johnson & Johnson. It was found that very rare, 1 in a million doses, that there was some clotting issues. And so to make things safe, they stopped using the vaccine until further evidence was revealed. And looking into it, very rare phenomenon of thrombocytic. It's mainly in women between 18 and 49. It's such a low risk, even in women between 18 and 49, it's only 7 in 1 million doses. And women over 50, it's 0.9 per million. And in men, it's essentially no risk. So, and to put it in perspective though, smoking or taking birth control pills is a lot a higher incidence of blood clotting, the same blood clotting mechanism. So, and actually getting COVID, it's a lot, you have a lot better chance of getting the thrombocytopenia that you get from that was caused from the vaccine, or some plausible cause of the vaccine. So with that, it's safe to resume because the benefits far weigh out any kind of risk, and it's a good vaccine. One good thing about the Johnson & Johnson, it is a one shot, and for many people that's very advantageous. So it's a good, safe vaccine. I would encourage anyone, if it's the vaccine that's offered to you, or I wouldn't have any hesitation at all to take it.
Perfect. Thank you, Dr. Yeka. And it looks like we do have a Facebook question here. So Darlene is asking, I want to know if you have had COVID and have received your first dose of the COVID vaccine, do you still need to take your second dose?
Yes. Yes, it's preferable to take your second dose if it's either Moderna or Pfizer. And of course, with Johnson & Johnson, it's just the one shot.
Perfect. And just reiterating, of course, it needs to be the same brand of vaccine.
Right.
All righty. And let me go ahead and check again to see if we have any other questions on Facebook. Okay, so it looks like we have no questions for the moment. For those watching us, we do encourage you to ask your questions. We will be here on this update here this evening. So for what happens if you only get your first dose? I know we've been trying to get our community to continue accessing the site, and then we also want to encourage Anne also make everyone aware of the importance of receiving your second dose if you received the Moderna or Pfizer vaccine. So what is the importance? What happens if you only get your first dose?
Okay, well, it's not all lost. Getting a first dose is 60 to 70% effective. And it's very effective in preventing hospitalizations and death, just the one dose. In fact, some countries like England decided to go with all one dose first and then use a second dose later so they could get more people immunized. They've had very success with that type of philosophy. So one dose is effective, but you need the second dose to get you up in that 90-some% effectiveness.
Thank you so much. And then at the Community Vaccination Center, we are starting to administer second doses too. So that's also an option for individuals to get their second dose of either the Pfizer or Moderna vaccine. And again, it has to be the same brand from your first dose. So that's also an option as well for our community. And I know a lot of questions that we have been hearing in our community. There's certain statements that have been made. One of them is, I got COVID-19, so I don't need to get vaccinated.
Well, we really don't know. And so to be on the safe side, we're recommending that you do. We don't know how long the antibodies titers last from getting the disease. And it might be a difference between if you've got a mild case or a severe case. It depends on your immune system. So many factors that we are recommending. We do know that you get a good antibody response from the vaccine. And so we want that antibody response. So to be on the safe side, it's better to know that you're protected than the big question mark. We'll know with a lot of studies been done, we'll probably know in a year or two about having the disease and if it's natural immunity. You know, like if you have measles, it's natural immunity. You don't have to ever worry about getting a shot, or, you know, many other diseases like mumps are the same way. We just don't know at this stage.
Thank you, Dr. Yeka, for that information. And then we do have a follow-up comment from Darlene, who asked a question earlier. She said Darlene is not looking forward to getting sick. Would you be able to talk a little bit more about what those side effects could be for individuals getting the COVID-19 vaccine?
Well, the side effects are very minimal. Most have a little sore arm for a day. Some will get a mild fever, but it's usually about a 24-hour. That's very even rare. Mostly it's just the sore arm or not feeling good for at least a day or so. Some do get a little bit more. They really get a sore arm, and they'll get 2 or 3 days of kind of flu-like symptom, but that's very rare. The benefits far outweigh but it's like all vaccinations, you know, there's some people do have reactions, just like the tetanus shot. The tetanus shot for me was worse than the COVID shot.
Thank you, Dr. Yeka. And I also like to share my experience. So this past weekend, I did receive my second dose, and I just had a sore arm as a side effect. So I was very, very thankful for that too. Just a little share my own experience here going through the Community Vaccination Center. And let me check to see if we have any other questions. Perfect. It doesn't look like we have any questions at the moment. Dr. Yeka, why is it important to continue wearing masks and to continue following public health recommendations?
Well, wearing masks has been very effective. And there's still some, there are some vaccine breakthroughs. We know that, and not knowing the status of other people, they feel more comfortable. So for those reasons, it's really necessary to wear a mask. And it's just not preventing COVID. This year, we had no flu season, essentially. Rhinoviruses were even way down. Very seldom we had any colds or anything. So it's very effective wearing masks for not only COVID, but for other reasons, especially when you're ill. So it's a good habit to form. Yeah, it won't be like COVID. I mean, wearing masks for everything, but I think in the future you're going to see more mask wearing, especially from people that are ill and traveling and things like that. You see it in the Asian countries for many, many years. They've worn masks. That's very effective. But it still is recommended because you still don't know. There's a few that do have the vaccine breakthrough, and even without the vaccine breakthrough, we don't know if you could have enough virus, even if you don't get the disease, that you could pass it on. Really, we just don't know. When you don't know for sure, it's best to err on the safe side.
Thank you again, Dr. Yeka. So I do want to transition a little to talk more about our community vaccination center at the Yakima State Fair Park. So I'm going to try to share my screen here. So just bear with me while I get that ready here. Okay, are we able to see my screen? I think so. Okay, so for individuals who are interested, you can go ahead and access our Yakima Health District page, or an easier way to do it too is by going to yakimavaccines.org, and it'll take you directly to our COVID-19 page. Here on our COVID-19 page, we will have information about the Yakima State Fair Park, and we do have new hours. So every day, the Yakima State Fair Park Community Vaccination Center is going to be open from 12 o'clock to 8 o'clock. So those are new hours that started on Sunday, and it's free, open to anyone 16 years and older. And one thing I do want to emphasize is no personal identification or documentation is required for this site. If you would like to register ahead of time, you can go ahead and do it via our PrepMod website, which I will show us how to do that in just a moment. Or you can also register on site to save a little bit of time as well. And if you do need help with transportation, there's an option to call the 211, and there they will be able to help you get to and from the vaccination center here at the Yakima State Fair Park. Additionally, if you do take bus, I know a lot of family members, a lot of people that I know do take the bus. Yakima Transit Route 12 will be able to take you to the State Fair Park. And for individuals who don't have a car, you can still access the site. You'll just have to walk through gate 1, and there will be a walk-up tent, and it'll be the same process. You can get registered on site there, get your vaccine, get monitored, and then you will be on your way. So that's a great option for people who get a ride to the Yakima State Fair Park, call the 211, or take the bus. We have that walk-up site for them. If you are driving to the site, you can enter through gate 12, and there you will be rerouted to the State Fair Park to get your vaccine. So that's a good option. And if you would like to schedule an appointment, going back to that, you can click on our graphic here, and it will take you to our PrepMod website, which is where individuals can schedule an appointment for their vaccine at the Yakima State Fair Park. So there will just be dates and which vaccine. Again, it's important that your first and second dose are the same brand, so individuals can sign up. Again, registration on site is also an option too for individuals, so people can still access the site. We're trying to reduce as many barriers as possible for our community to continue accessing it. And apart from our site here at the Yakima State Fair Park, we also do have availability for our mobile units. So our mobile units are going throughout Yakima, throughout the lower valley. So there's a lot of opportunities that could be near you if you'd like to get vaccinated too. And here we will also have a list of our community COVID-19 vaccine clinics that are happening throughout our county. So it looked like today, Fiesta Foods was going to have 1 second doses. We'll also put notes if they're second or first doses. So this one looks like it's going to be second doses available to those who received their first dose on this date. And then moving on, there will be tomorrow, there's quite a few events, and it looks like throughout the week, there's quite a few events, and they range from Fiesta Foods in Yakima and Sunnyside, the Grandview School District, Zoa High School, LaSalle High School, Toppenish Flea Market. I know we've been going there these past few weekends. And the Yakima Nation Cultural Center. So those are just quite a few that I'm naming off here, but we'll be updating this every week for locations. And again, it's just an easier URL is just yakimavaccines.org, and it'll take you directly to our page here. So that's a great resource if you'd like to share it with your friends and family. Let your parents know, your neighbors, community members, people you go to church with, your networks. These are locations that could be near you and you can get your vaccine shot there as well. So we definitely want to encourage that. We're grateful that we're able to have this site at the Community Vaccination Center and also our mobile units to continue reaching our community and continue vaccinating them as well. So that's something I wanted to go over. Dr. Yeka, is there anything else that you would like us to go over? Any other comments before we end here?
Yes, I would. I would really encourage vaccination. A lot of people say, well, I'm young, it's not that bad a disease. But the problem is you can give it to others that aren't young, that have illness, that have other illnesses and are older. And it is a bad disease for them. We've had 18 deaths in Yakima County in the last month, 18 deaths from 44 on up. So it's just, we want to prevent that, and we want to get out of this. We want to get back to normal lives again. And the way we can do that is get our people vaccinated. If we can get enough vaccinated, then a lot of these, we can stop the spread of a disease in our community and save a lot of lives.
Thank you, Dr. Yeka. That is a good point to make across. And we are also trying to address this vaccine hesitancy. And I did want to share a couple resources that I believe would also be helpful for community. We have them all on our YouTube, and I'm going to share my page again, share my screen here. Okay, so on our YouTube page, which is the Yakima Health District, last week we did have a series on frequently asked COVID-19 questions about vaccines, like why should I get it? What happens after I'm vaccinated? I'm a little nervous. Which vaccine should I get? What is a booster dose? Where should I get my vaccine? So it's a lot of great information, and they're all a little short, a minute or less, and it's in English and in Spanish. So we've been sharing these two on our social media, and we have them all uploaded here. So if you are interested, need a little bit more answers to your questions, those are also great resources for you to have as well. And then I did want to also show, we did have a COVID-19 y la vacuna event. It is in Spanish, so individuals who speak Spanish, they talk a lot about the vaccine, COVID-19, and just a lot about all the questions that the community may have too. So that's also another great resource. But with the Q&A, the frequently asked questions, those are both in English and Spanish. So we definitely encourage you all to look at them, have your questions answered. And if you still have more questions, definitely direct them to us, and we'll be more than happy to help as well. Okay, perfect. Well, if that is all for today, Dr. Yeka,
Okay.
It looks like we can wrap it up here. So we're definitely encouraging people to continue following public health recommendations, get vaccinated if you haven't done so already. We're trying to build our immunity for our community. It's very important that we get vaccinated. And if you have gotten vaccinated, you can definitely be a part of our campaign. It's the hashtag #IGotTheVax, YKM. And I can also add it to our comments here on our Facebook Live. And that's just encouraging our community to continue to get vaccinated and participate in our campaign and share a reason why they got vaccinated. So that's also a great opportunity to have more of our community engagement here. But for a final wrap up, that is our update for tonight. So our next English update will be on May 11th. It'll be the same time, Facebook Live at 6 o'clock. And next Tuesday on May 4th, we will be having our COVID-19 update in Spanish. So please join in or tell your friends and family if that would be helpful for them too. Gracias por acompañarnos hoy en nuestra actualización. El próximo martes 4 de mayo a las 6 de la tarde vamos a tener nuestra actualización en español. So esperamos verlos ahí a todos. And again, Dr. Yeka, thank you so much for your time tonight. And we will see you again in the next one.
Good to be here. Bye.
Thank you.